start, and we'll go. We'll just keep this going. Okay, what about headaches and the surgery? Well, remember, if you have diabetes and the surgery, we have a chance of curing your diabetes. If you have high blood pressure and the surgery, we have a chance of curing your high blood pressure. If you have atrial fibrillation and heart failure, we have a good chance that we're going to cure that heart failure and get rid of the atrial fibrillation. Big stuff. What about headaches? What do we do for headaches? What happens with headaches? Well, to answer that, I want to talk about weight loss and fluid and come back to the head by working up from your toes. So first of all, let's give you some statistics on the MGB surgery. The average weight of the average person who comes to see me, and we've now been doing it for 11 years in almost 5,000 people, the average weight of the person who comes to see me is right at 300 pounds. And it's usually a 39-year-old woman. The average age is 39. 85% of our patients are female. And on the day of surgery, they weigh about 300 pounds. Okay? 1 month after surgery, the average weight loss is 30 pounds. 10% of your body weight is lost in the first month. At the end of 3 months, the average weight loss is 50 pounds. At the end of 6 months, it's 80 pounds. And at the end of 1 year, the average weight loss for my average patient is 140 pounds. Pretty good. And we talked about diabetes. Now let's go back to that first month. Our average person has lost 30 pounds in the first month. 30 pounds of what? Water. Right, exactly, fluid. Okay, now I want you to go back and imagine that you're that patient. What do you think happens to your swollen ankles? Goes down. What happens to your blood pressure if we take 30 pounds of water out of your bloodstream? Blood pressure goes down. What happens to your swollen, painful knee joint if we take 30 pounds of water out of the knee joint? Less pain. Let's take 30 pounds of water out of your lungs. Can breathe better. Let's take 30 pounds of water out of your sinuses. Wow, my allergies are better. I can breathe better. I can smell. The aromas of turkey and foods and all that stuff are different now. Oh boy, Thanksgiving is a different thing when I can smell and breathe better. Let's take 30 pounds of water out of your skull. If we measure the intracranial pressure in people who are overweight, it's elevated. In other words, obese people have high intracranial pressure, and that hurts. If we pump up the pressure in your skull, it squishes and pinches and hurts the brain, and you complain of a headache. So heavier people have more headaches. And if we lower that pressure, your headache gets better. And we do take 30 pounds of water out of your head, so almost all of our headache patients get better after the surgery.
Now, for someone with polycystic ovarian,
yes,
who could have the migraines and the headaches with it, I understand with the Tylenol, but can you take ibuprofen?
No.
No.
Nothing, sir.
So you just have to gut it out.
Well, the pain of her headaches and the polycystic ovary disease may be linked to her obesity. So that what we expect, if she's our average patient, we can ask thousands of people who've had the surgery. You can ask thousands of people that have had my surgery. Before surgery, my patients have access to every drug in the grocery store, every drug behind the counter at the drugstore. And after surgery, as you've heard, I take it away. I take away all those medicines.
I'm sorry to interrupt.
Oh, this is good. Is that his numbers?
Yeah. A little bit better.
15.4. 1.13. Close. We'll talk a little bit about whether or not to wait one more day. Remember we had to fuss with your doctor, you only wanted to quit the Coumadin for 5 days? We'll edit that part out. Okay, good. So my patients, I have thousands of people that I can talk to, that I have asked this, and you can talk with, and here's their choice. Which life do they like better?
Oh, yeah.
A life beforehand when they could have every drug in the grocery store, every drug in the drugstore, every drug that could be prescribed to them, or the life afterwards where mean old Dr. Rutledge takes away all those drugs. Which life do they have more joint pain? Which life can they walk better? Which life do they have less headaches? And what we see is every single patient says that they have a better life after the surgery, that they have less headache. Yes?
They don't need a lot of those drugs anymore.
Right. So many of them, now here's the issue though, many people get better, but not 100% better. So we often have people with bad osteoarthritis, knee pain, ankle pain, things like that, and they get 75% better after the surgery. They get 85% better after the surgery, and then they call me and say, now can I take ibuprofen because I have a little bit of joint pain left? And our advice is, perfect is the enemy of good.
Right.
That if you say to yourself, boy, I am so much better. Like I had a lady call me and said, this is terrible. I'm in terrible pain in my knees. The surgery's not working. I said, really? That's surprising. You know, I said, you know, what are you doing? What's, you know, she said, well, you know, I've taken up running. I run 6 miles a day and my knees are killing me. I'm going, and I said, what'd you do beforehand? She said, well, I was in a wheelchair. And I said, well, you know, you may not be able to run 6 miles a day. You know, you might have to, you know, give that idea up. And she says, well, I would like to take ibuprofen so I can run again. I said, well, you know, you have to balance your expectations. And there's not a guarantee that headaches will go away. But again, you can talk to thousands of people. You know, that's the neat thing. You can talk to thousands of people that have had headaches before my surgery and see if they don't say they are happy that they had the surgery, even though we've taken away the ibuprofen.
Well, for her, even prior to the weight gain, she had the polycystic, and she would get headaches, and she has a low tolerance for pain as a kid. But anyway, she, it's, yeah, not her. But it usually came around menstrual periods.
Right, but we, even before that, she may have had abnormal estrogen levels that may be fixed by the surgery. The surgery is not, this is important to emphasize, the surgery is not just weight loss.
Right.
It's not just weight loss. We have tremendous, and we used to think that, so it's not unreasonable to think that. Well, surgery is just weight loss, so why don't you just eat less and exercise more? It's the same thing. No. The bypass changes the hormones. It changes estrogen. It changes insulin. It changes glucagon-like peptide and gastrointestinal peptide and ghrelin and peptide YY, so that you're a different person afterwards. Now, there's not a guarantee that the new person is going to be the one you want, but most of the time people are very excited, very pleased, and very positive about those changes, and you can see that in our patients.
I'll follow to that.
Yeah, can I get an amen?
Amen.
That's right.
I have a few questions.
Yes, okay, well, let's stop. That's good. We talked about estrogen, but